Olá y muy buenos días a todos.
Hello and good morning, everyone. Thank you for being with us at this PAHO's virtual press briefing on the pandemic of COVID-19 in the Americas. I'm Paulo Lida from the Communications Department of PAHO, and this session will last between 45 minutes and an hour, and we will take questions up until that time. We've already received questions by email, and you can also ask questions on live or over the chat or through the Q&A app. Please include your name and the media you represent when sending your questions. Let me also remind you that we have simultaneous interpretation services available into English and into Spanish. Dr. Jarbas Barbosa will offer a report on the epidemiological situation in the Americas. Dr. Barbosa, Assistant Director of PAHO, and he will also refer to some steps that ought to be taken by countries in connection with the holidays, end of the year holidays. With Dr. Barbosa, we have Dr. Ciro Ugarte, Director of the Health Emergencies Department of PAHO, Dr. Marcos Espinal, Director of Communicable Diseases, and Dr. Silvan Alighieri, Incident Manager of COVID-19. Once again, thank you very much for being with us. And now I give the floor to Dr. Barbosa, Assistant Director of PAHO. Thank you, Paulo. Good morning. Good morning, everyone.
Today's press briefing. At the start of the pandemic, there have been more than 25 million cases and more than 700,000 deaths due to COVID-19 in our region. Since our press conference last week, more than 1.5 million cases were reported in the Americas, the highest weekly numbers since the start of the pandemic. And while a rapid surge of infections in the United States has been a major driver, cases are continuing to accelerate in some countries of North, Central, and South America as part of a mosaic of different epidemiological patterns we are seeing. In Canada, infections are rising, particularly among the elderly. The virus is also reaching high numbers among indigenous communities, which are especially vulnerable due to their remote locations and challenging access to health infrastructure. In Central America, Panama reported its highest weekly case count since the beginning of the pandemic. As epidemiological information is delayed in many countries impacted by recent hurricanes in Central America, we remain concerned about the potential for outbreaks in overcrowded shelters. Throughout the Eastern Caribbean, cases are rising, particularly in St. Lucia, which has reported an outbreak originating in the crew of a docked cargo ship. And in South America, the recent case increases in some states of Brazil is continuing. The dramatic rise of cases in some departments of Uruguay, the only country of South America not reporting community transmission, is an example of how quickly the situation can evolve in all of the sub-regions and countries of the continent. Many people are understandably encouraged by recent developments in the search for an effective COVID-19 vaccine. But we must continue to be patient and cautious because it will be months before a vaccine is widely available. This is why it is critical that everyone continue to practice the public health measures that we know are effective in controlling the spread of the virus. Wearing a mask in public, including in the presence of persons from other households, keeping a safe distance from others, avoiding the 3 C's, spaces that are closed, crowded, or involve close contact with others, and washing our hands often. These measures are especially important as we enter the holiday season. In the Americas, the holidays usher in some of our most cherished traditions. Our towns and cities come to life with decorations, communities congregate to mark religious celebrations, and generations of families come together to give thanks. After months of staying at home, many of us are weighing difficult decisions about whether to see friends, gather with family, or travel to see loved ones during the holidays. So today, I'd like to provide some advice on how to celebrate responsibly this holiday season. First, all of us must remember an important truth. During a pandemic, there is no such thing as a risk-free holiday season. Every gathering, every shopping trip, and every travel plan increases the chance of spreading the virus. So we urge everyone to weigh their options carefully and follow the guidance of national health authorities. Despite the risks, there are a few common measures we all can take to make the holidays as safe as possible. Let's start with mass gatherings, which are treasured cultural tradition. Communities across our region are grappling with choices about whether to host religious processions, holiday markets, and church celebrations. PAHO and WHO recommend that countries experiencing widespread transmission of the virus should seriously consider postponing or reducing mass gathering. This is not the time to be hosting any large gatherings. Each country, city, and community should base decisions about hosting public events on the latest available data, especially data that show where the virus is spreading and whether health systems have enough capacity to keep up with cases. Regardless of location, religious services should look different this year. They should be held outdoors whenever possible or limited in size when it's not. It is also important to talk about the smaller indoor gatherings. Indoor gatherings, even smaller ones, can be especially risky because they bring together groups of people, young and old, from different households who may not all be adhering to the same infection prevention measures. They should be held outside when possible, and participants should wear masks and maintain social distancing. If held indoors, limiting group size and choosing well-ventilated areas can help reduce exposure. And although it may feel awkward to wear masks and practice social distancing when we are around friends and family, doing so is the best way to ensure everyone remains safe and healthy. Finally, it's important to talk about traveling. It goes without saying that the safest option for everyone is to stay at home. But we know some people have made the decision to travel this holiday season. Many may be thinking that testing will help them travel safely. COVID-19 tests are an important tool for tracking and tackling the spread of the virus, but we must be careful that testing does not give us a false sense of security. It can take a few days before a diagnostic test can detect a COVID-19 infection. So, if a test is done too soon, a person can test negative while still being infected and contagious to others. And because these tests are typically done a few days prior to travel, a traveler could still be exposed to the virus in the days leading to their departure. Because of these realities, PAHO does not recommend relying on laboratory tests for travelers. Yet we've seen countries across our region and throughout the world place testing at the heart of their travel policies. This cannot guarantee safe travel or eliminate the risks related to infected travelers. And resources can be used in other ways, yielding a greater public health impact. Tests are expensive, hard to implement, and have limited impact on controlling the international spread of the virus. At the same time, they waste precious resources and divert limited staff from necessary functions like contact tracing. We are pleased to see that some countries in our region are relying on more common sense measures, such as using data about how the virus is spreading to continually reassess their travel guidance. We hope other countries follow their lead. To make travel safer, all countries should collectively work to prevent from traveling those who have COVID-19 and are in isolation, as well as their contacts who are in quarantine. And while it is important to monitor travelers for 14 days after arrival, travelers should not be placed under quarantine or subject to movement restrictions. The holiday season is a time for family, community, and renewal. And while this year may look different, that doesn't mean we cannot make the most of it. Throughout the pandemic, our region has reimagined how people work, go to school, and participate in civic life, so that we can keep our friends and families as safe and healthy as possible. The holidays should be no different. People are planning virtual dinners, broadcasting virtual celebrations, and opting for smaller ceremonies, even if it means making personal sacrifices. The individual decisions we make this holiday season won't just affect the people closest to us. They will also impact our communities. Solidarity has been the engine of our region's response to COVID-19, and it will be more important than ever during the holidays. And keep each other safe, we can ensure a better, brighter start to the new year. Thank you. Paulo, we cannot hear you.
Muchas gracias por las palabras iniciales, Dr. Barbosa.
Thank you very much, Dr. Barbosa, for your initial statement. And the first question we have today comes from Laura Barros, correspondent in Washington representing FA Agency. How will the COVAX facility assist us in providing options to countries in Latin America and the Caribbean in order to have access to a vaccine against COVID-19? Dr. Barbosa, please. Thank you for the question. There are expectations that we all have awaiting vaccines against COVID-19. In the last 2 weeks, we had news from the manufacturers of vaccines letting us know that they had preliminary results that were very interesting, highly effective and efficient with the vaccines. But it is important to stress the fact that it is necessary to complete all the studies and that the data, the results can be published in scientific publications so that the international scientific community can check all the data, all the results, and for the producers or the manufacturers to show the results before the regulatory authorities. And with that, we will be able to have vaccines authorized by regulators and pre-qualified and pre-rated by the World Health Organization. COVAX is a novel facility because it works with all the manufacturers. This means that it is a basket of manufacturers. So we will have several options to offer our countries of manufacturers that can have the best combination of a very effective and safe vaccine with a vaccine that is affordable because of the price of the doses and that it is in keeping with the characteristics of the cold chain in each country. We already have more than 184 countries in the world that are participating in this COVAX facility. The Pan American Health Organization, together with UNICEF, is the facility that will move forward with the bid for the manufacturers, and we've already begun with about first public tender. So besides the bilateral agreements that are entered into by each country in keeping with their own decision with one or two manufacturers, this COVAX facility is a very important alternative because it would provide us this possibility of having a basket of manufacturers, any manufacturer anywhere in the world that have a vaccine that is safe and effective and efficient, that can participate and can offer the best solutions for COVAX. By December, we believe that we will have the first proposals from all manufacturers that will be presented for a decision by countries in keeping with their options. Thank you. Thank you, Dr. Barbosa. Next, we have a question from Matias Lowy from Argentina, from the Medscape Agency. In practical terms, PAHO, do you see any differences between vaccines that at the end of the studies in phase 3 report 90, 91, 92, or 95% effectiveness? Dr. Espinal, please. Thank you very much, Matias, for this question. Very important. And the answer is simply no. There's no difference. A vaccine that has more than 90% effectiveness is a good vaccine, and it can be used. Now, we not only see the effectiveness in the vaccines, but we have to take a look at several characteristics. We have to see the problem in the cold chain, which is the logistics, very important, because as we've seen, for example, the Pfizer vaccine, which is a vaccine that has been effective in keeping with the preliminary data that have been released, you have to store it at very high temperatures that are not available in many of our countries. We also have to take a look at the prices of the vaccines. We've already seen how the 3 vaccines that have been announced, and even the 4th vaccine in a way, or the Russian vaccine, that also seems to show somewhat promising results. These 4 vaccines show different prices. Thus, the important thing, as Dr. Barbosa was saying, is that we have to help each other with well-established mechanisms such as PAHO's revolving fund and the COVAX facility, WHO and CEPI, because they will provide advice to countries as to what the best options are. But we shouldn't think that the only characteristic to be considered is the effectiveness or the efficiency of the vaccine. We also have to take a look at the methods. There's certain vaccines that are being tested, and there are different methods that are followed because of genetic material, DNA, RNA, or because of deactivated viruses and proteins. So we do have a whole set of characteristics, and we shouldn't base our decision exclusively on the effectiveness and that they all have over 90%. But in fact, a vaccine with over 90% effectiveness is efficient and should be used.
Thank you very much, Dr. Espinal. Now, as a follow-up, this is by Alexander Mendina from Faith and Happiness Radio in Venezuela. Is Venezuela participating in the revolving fund that PAHO has for the acquisition of vaccines? Dr. Ugarte. Thank you very much. Yes. Venezuela does participate in the revolving fund for vaccines, and they have been participants for many years now. However, due to the current situation in Venezuela, the country has been unable to make payments towards the purchase of vaccines. Therefore, the accumulated debt is about $11 million. Then it is not possible to purchase vaccines through the revolving fund for Venezuela, even though the credit line had been increased for the country. However, PAHO and UNICEF are supporting Venezuela to purchase vaccines. We were able to obtain donations from other sources, and also the technical and logistical support that are being implemented in Venezuela are intended to increase vaccine coverage in Venezuela by means of strengthening routine vaccination and also carry out vaccination campaigns. And PAHO is currently supporting the whole immunization network offered by the Ministry of Health by deploying practitioners to the 24 states who will be devoting to expand the immunization program. The immunization program, not only in Venezuela, but throughout the countries in the region, is our first priority. COVID-19 has impacted essential services, and one of the programs affected significantly has been the immunization program. So once again, I'd like to highlight the importance of immunization coverage for all of the vaccine preventable diseases that we could be facing. Thank you.
The next question, it's maybe a complex question or has three questions into one. So I'm going to read them slowly. It comes from Jose Cueto from the BBC Spanish service in London. Overall, which percentage of the population should each country vaccinate to achieve herd immunity and bring normal life back? The second part, does the percentage vary depending on countries' infection rates or the number of people already immune in a country? And the third part, how long could vaccination campaigns last to achieve herd immunity and bring normal life back? Dr. Aldiguieri?
Yes, thank you for the three questions from the BBC colleague in London. Regarding the first question, which percentage of the population we need to immunize to achieve herd immunity? In theory, the population immunity threshold is that 60 to 70% of the population be immune either through natural infection or vaccination. This is the first point. But in reality, we don't know exactly the fraction of the population who is already immune, even when we measured through sero-epidemiological survey, serologies. We don't know whether what is measured correlates with protective immunity. The current situation in Europe seems to indicate, even in areas highly affected during the spring wave, with sero-surveys indicating that 20-25% of the population have antibodies, they are now, during the second wave, experiencing outbreak. Overall, we can expect that vaccination with slow transmission gradually, as more and more people in the general population will be vaccinated. Now, the second question regarding the percentage of people in countries that are already immune. It is difficult to anticipate how big is the percentage, and it would vary from a country to another. We don't have a picture at regional level, and it will vary a lot country by country. And now the third question, it's how long vaccination campaigns last to achieve the herd immunity and bring the immunity, normal life back. I will speak regarding the situation in the Americas specifically. In the Americas, countries have an enormous experience in carrying out very large vaccination campaigns. I'm thinking about the yellow fever response in Brazil in 2017, 2018, with dozens of millions immunized in a couple of months. The rubella campaign in Brazil also in 2008, when in a period of 3 months, 70 million adolescents and young adults were immunized against rubella again in a period of 3 months. So it will vary from a country to a country, depending on the investment and the resources and human resources that will be mobilized for the vaccination campaign. However, we anticipate two major challenges, is that vaccines will be available gradually, step by step. Some countries will access during the last weeks of 2020 some vaccines, but in most of the countries of the continent, this will be a gradual access during 2021 and even 2022. And the second main challenge is that we don't know yet whether the population will readily accept to be vaccinated. This is a huge challenge in terms of communication with the public and to explain to the individuals and to the community what are the benefits of vaccination against COVID-19 for individuals themselves and also at community level. So I hope I have answered the concerns and the three long questions of the journalist from the BBC. Over to you, Pablo.
Paolo, can I jump in and add something to
Yes,
in
please,
answer
go
to
ahead.
my colleague, Dr. Aldigeri? Let us not forget that this is the region probably that vaccinates more than any other region. The experience of this region with vaccination was the first to eliminate polio, the first to eliminate smallpox. So, and the famous vaccination week that is held every year, which is now global vaccination week, started in this region in the Americas. So the experience in the Americas is massive. And there is no doubt there are challenges, like Dr. Aldigeri said. But let's be confident that when the vaccine is ready, and PAHO help our member states to roll out this vaccine, whatever vaccine is, we're confident that our region will be vaccinated, because it's 8 billion people in the world. So it cannot be vaccinated, as Dr. Aldigeri said, in a day or so. But let's be confident that the experience of the Americas is going to be vital in ensuring our people receive the vaccine for COVID. Thank you.
Thank you, Dr. Espinal. The next question comes
Thank you,
from
Dr. Espinal.
Alexandre Villegas from Haikai Magazine. And there is also a similar question from Joe Coates from FLSRA from the United States. So the Alexander is asking, how have the back-to-back hurricanes affected the response to the pandemic in the Americas? And he's saying that he understands that hospitals are very heavily damaged, and he's asking what other logistical problems have the hurricane caused in the region. And Joe Coates is asking, in addition to that, if there is any international aid to help people experiences or to help to prevent a COVID crisis in areas of mass evacuation and close quarters at evacuation centers in the cities. Dr. Ugarte, por favor.
Thank you for those important questions. And I would like probably to share some of the situation in the slides. I can share with you. I don't know if you can see it. Yes. All right. Look, the balance of the situation of the hurricanes, as you can see over there, is very hard. Both hurricanes Eta and Iota. More than 8 million people that have been affected. More than 653,000 have been evacuated. And look at the number of health facilities according to following the question. More than approximately 640 health facilities that have been damaged in the middle of the pandemic. And then we see how those two hurricanes have affected almost the same areas of Nicaragua, Honduras, Guatemala, and also El Salvador and parts of Belize, and also, of course, in some areas in the Caribbean as well. And these are the numbers of health facilities that have been affected in Honduras, Guatemala, Nicaragua, and Colombia. And there are hospitals, there are health centers, and there are also areas that provide healthcare to the people in their communities. And the shelters that are being organized in the countries are hosting thousands of people, and not necessarily the conditions at those shelters are okay, and will not be able to prevent transmission from COVID-19. You see some of the pictures that will show you how the situation is. It's, of course, this is a very challenging situation. And in a summary, we can say that one of the most affected programs has been especially the surveillance system. And if we see the graphic, this is the graphic of the reported cases by Honduras on COVID-19, and you see how in the areas when the Hurricane Ida affected Honduras and then the rest of, Nicaragua and the rest of the Central America, the number of cases reported dropped dramatically. And also after Hurricane Iota, the numbers have been reported also in lower numbers. So this is clearly a challenge for reporting the new cases and also detecting the new cases. That's why PAHO has been supporting the countries to increase not only the public health interventions, but also testing at the shelters or where the communities were affected. And these are the summary of the hurricane impact and the health risk. Damage in health facilities, of course, it means loss of access to healthcare in already vulnerable populations, lack of health personnel, and decreased health capacity in both hospitals and shelters which contain vulnerable population, including the elderly, as we saw in the pictures, and decreased water and sanitation services. Of course, it produces difficulty of maintaining infection prevention and control efforts and increase the probability of waterborne and other communicable diseases, including COVID-19. And the crowded shelters increase the risk of transmission of this disease and spreading addition to other endemic diseases. We are talking about dengue, leptospirosis, and malaria, and other diseases. And the damage of collapsed roads also prevents access from humanitarian response and so. So we are seeing that all these challenges are currently affecting all those countries, and all the efforts that the multisectoral approach, the multisectoral system, and the health sector are providing to the communities affected are also being accompanied by the solidarity of the international community, and of course PAHO's teams on the ground are also accompanying not only on the assessment, but also on the response and reducing the suffering of the population, and of course trying to reduce also COVID-19 transmission. Over, thank you.
Thank you, Dr. Ugarte. The next question comes from Pamela Paun from Politico in the United States. I know that three groups, I know that the WHO has advised countries' priorities when planning to deploy vaccines, but how are the countries going to deal with issues such as who to prioritize between a 70-year-old that is healthy and a 30 years old with diabetes, for example? Dr. Barbosa?
Thank you for this question. I think that is important. Silvano Digueri has already highlighted that the first objective with the vaccine is not to eliminate the transmission. We will probably, unfortunately, will not have enough vaccine to vaccinate everybody or to stop the transmission the other day. So the recommendation is to use the vaccine when the vaccines are available for the main objective, that is to save lives. So the first that should be vaccinated are health workers, because they are at the front line, because it's important to protect them and also to protect the health services to keep it running and to offering health care for everybody, for non-communicable diseases, for immunization, for TB, VIH, malaria, and others. So health workers and other social workers that are at the front line, such as teachers, firefighters, and others, should be the first to be vaccinated. We estimate that this is a group that it's around 3% of a population of each country. After this group, we can reach other group that correspond to around 17% of the population, that is people with 65 years and more, because they are at a higher risk to develop a severe case of COVID-19 and to die. And the other adults with 30 or 40 years that have underlying conditions that are also a higher risk to develop a severe case, such as diabetes, such as hypertension, cancer, and other chronic diseases. So these two groups that will be a total of around 20% of a population of a country, this is the main objective for the first semester of 2021. After that, we can use, if the vaccines are more broadly available, we can use the vaccine along the other measures that we know that can work to reduce the transmission of the virus to be used in a different strategy to reduce the transmission, or even in the near future to eliminate the transmission. So with this strategy, this country, they should not have this choice between a healthy 70-year-old or a 30-year-old that has diabetes, because both are in the second most important group to be vaccinated. Of course, these are recommendations from WHO. Our technical advisory group is working also to make this kind of recommendation to the countries, but the countries will develop and will have their own strategy. But again, this is what we are seeing for the first phase, when we will have a limited number of vaccines and we will need to prioritize their use to save lives. Thank you.
Gracias, Dr. Barbosa. La pregunta
Thank
siguiente.
you, Dr. Barbosa. The next question is by Elias Budasov from the EFE media outlet, and he's asking about the main obstacles in the near future for Latin American communities to have access to a good vaccination index, public policies, trust, availability of the vaccines. Which element would you recommend mandatory vaccination? Dr. Barbosa, could you please address this question? Thank you very much, Elias Vidafore, for the question. I think that we have already mentioned some of the difficulties. I am certain that we are going to have one of the most important outreach operations throughout the countries to guarantee properly organized vaccination campaigns so that the health workers at the vaccination centers are properly trained and have all of the personal protection equipment and all of the supplies they need. So PAHO is working on the development of national plans, because this goes beyond the vaccine. This has to do with having a strategy, the preparation, and communication is also highly important. The COVID-19 vaccine, unfortunately, entails rumors and conspiracy theories, and also lack of information through social networks. So we are supporting countries. We had webinars for journalists, and we are sharing with the ministries of health, and we are also reaching out to the national health authorities to coordinate, to provide information in a transparent fashion, so that this is based on evidence and we can actually inform on the process we have to develop a vaccine, to manufacture a vaccine that has already been licensed for its administration, the guarantees, the quality guarantees, and vaccine safety measures. So that is on the one hand, and the countries do have campaigns that for mandatory vaccination. Vaccination is not just individual protection, but it is also collective protection. Let's think the following. If we have a vaccine that is 95% effective, it means that out of 100 individuals vaccinated, 5, even though they had been vaccinated, they are not going to develop the immunity or the capacity to be protected against the infection. That's why we are calling this a primary failure. The immune system of that individual is not able to manufacture those or develop those antibodies. So if some individuals are not vaccinated, the transmission of the virus continues, and also the elderly, cancer patients, patients and patients also with hypertension that have already been vaccinated are already at risk. So the COVID-19 vaccine and also the measles vaccines and the polio vaccine are not just for individual protection, but any individual that is vaccinated is helping protect those individuals that are not vaccinated or who got vaccinated but did not acquire immunization after the vaccine.
Dr. Barbosa.
Thank you very much, Dr. Barbosa. Next, we have a question by Camilo Franco Nora from Deutsche Welle in Spanish. How do you see the announcement made by the Russian government of the vaccine against COVID-19? Because some Latin American countries have already agreed to procure some doses from Russia. Dr. Espinal? Yes, thank you very much for the question. Very important, in fact. There are countries that have already entered into agreements. The Russian vaccine from the Galileo Institute has already published the first findings of phase 1 and phase 2 data, which are the earliest. It was proven that it is provisional because it does generate immunity. It is based on viral vectors that are different than the other vaccines, such as Pfizer and Moderna with genetic material. But this is a vaccine that we still have to wait, hasn't been approved by regulatory entities. And besides the results that have already been disseminated by the Russians have not been published in scientific peer-reviewed magazines, scientific magazines, and it is important for this to be done. The publication of the first phase was in a peer review magazine, but phase 3, which is the important phase where we can already see the large number of people receiving the vaccine and other people that are receiving the placebo, has not been published. And the results that have been disseminated or publicized are very few. They're not sufficient, 20, 30 patients that received the vaccine. So it is imperative that we be able to have access to the data when published. We will review the data when they're published, and we hope that in due course, the Russian authorities will be able to disseminate the results for regulatory agencies in other countries to have access. There is still no vaccine that has been approved. The latest news about the vaccines, such as Pfizer, Moderna, AstraZeneca, and the Gamaleya, are preliminary results. So we have to be careful in generalizing and be patient, and in the meantime, to continue with mitigation measures, which are what is going to control the virus and the transmission of the virus in our countries. But it is promising. The vaccine is promising. We just have to wait for the results, final results. There's another question here by Tanya Smith Cartwright, the Tribune, South Bahamas.
Are we going to see a spike in the Bahamas and region shortly after the Thanksgiving holidays due to travel? Dr. Barbosa, could you please answer that?
Yes, thank you for the
contestar a
question.
esto.
Of course, that this spike can happen, but the idea that we are encouraging the health authorities is exactly to prevent this to happen. If they take all the measures, not only the health authorities, but if the communities, if the families, as I mentioned in my opening remarks, we can enjoy Thanksgiving, Christmas, New Year with our families, our communities, but we need to keep in mind that all kind of gatherings can be very risky. All travels can be very risky. So it's important to act now to prevent these spikes, to prevent the spread of the virus. We need to keep wearing masks. We need to keep the physical distancing from the people. We need to think twice if a travel is really necessary to be done this time. We need to think about small gatherings with the family, wearing masks, even when we are in a celebration with our family. So it's not, we cannot predict that there will be an outbreak after the holidays. But we know that this can happen, because we will have more people traveling, more people getting together, more people going to close the spaces. So we need to be very vigilant about that and to adopt at the national, at the local, at the community, and at the family level all the measures to prevent this kind of situation.
Gracias, Dr. Barbosa.
Thank you, Dr. Barbosa. Next, we have a question by Claudia Dupeyron from the Prensa Latina Agency. The biotechnological industry in Cuba works on 4 projects of vaccines. Is the organization considering the acquisition of some of these drugs for populations such as Afro-descendants, indigenous, and other vulnerable groups? Dr. Espinal, please. Thank you very much for the question. And as we all know, Cuba has a history of contributing with vaccines to our countries and our societies, and we're following closely the development of these vaccines against COVID in Cuba, but it's still very early. They are in very early stages, research stages, and we cannot still determine what is going to be the future. We have to follow this up continuously, and if the vaccine is effective, PAHO and other mechanisms such as the COVAX facility will be able to use not only these vaccines in Cuba, but other vaccines that are already underway. That is why the COVAX facility has already 10 vaccines in its portfolio. But it is important that we continue assessing the progress made in the development of these vaccines, and not only in Cuba, as well as in other countries that are doing research and looking into the over 200 vaccines that we currently have. I'd like to add a little bit to this. Besides the fact that Marcos Espinal has already spoken, we received from Cuba and also from Brazil requests for support for these vaccines that are at a very early stage of development, that Dr. Espinal has said. In the pillar, the accelerator of tools for the response to COVID, we have 3 groups in the accelerator. One of them is to support the development and research. And this group is coordinated by CEPI, and CEPI is a Coalition for Epidemic Preparedness and Innovation. And we are providing technical guidance for initial clinical phase 1 and phase 2 assays. And these Cuban vaccines, as well as 11 projects in Brazil that are currently under development, are being included so that they can request resources from CEPI. This is a public call, and so other projects in Argentina and in Mexico and anywhere in universities and research centers can ask CEPI, they submit a proposal, and then CEPI can provide support, because there are many in this initial stage, as has been stated by Marcos Espinal. Thank you very much, Dr. Espinal and Dr. Barbosa for the response. We have a question from Ricardo Gouveia from CNN Brazil. And the question is in English.
The logistics of the distribution of the vaccine and if PAHO has any role in this process. Dr. Barbosa, por favor.
Thank you for this question. You know that every country in the region, in the Americas, they have a very well-established immunization program. The countries in this region, they know how to organize massive immunization campaign. We have done this for many diseases, against polio, against measles, against many other diseases. We are supporting the countries, of course, that they need to be prepared. It's not only to have the vaccine, but to have a strategy, to have a national plan, to know how they will train the health workers, how they will protect the health workers, how they will communicate with the population about the priority groups to be vaccinated first, and of course about the logistics. We have one vaccine now, the vaccine from Pfizer, that will require not only for Latin America, but this is a challenge for even for developing countries, for rich countries, because this vaccine from Pfizer will require to be stored in a freezer that will require minus 70 Celsius degrees. This is not used in any national immunization program. This is the kind of freezer that some laboratories that are focused on research, they use this kind of freezers. So if a country is thinking to make an agreement with Pfizer and to purchase their vaccines, these countries will need to think about how to have this kind of freezers, to have capacity to storage these vaccines. The other vaccines, the other 10 vaccines besides Pfizer that are in phase 3, they can be stored, they can be deployed using the regular cold chain that the countries have already in place, and they have good experience to use the infrastructure. But it's important to review if everything is part of the process, to review if everything is running properly, the storage rooms, the distribution, how they will reach the indigenous population, people living in rural areas. So all these aspects that are very important to be contemplated in a national plan to a massive campaign vaccine as we will face next year.
Muchas gracias, Dr. Barbosa y a los panelistas.
Thank you very much, Dr. Barbosa and the panelists. With us come to the end of the session. And you will receive by email the statement by Dr. Barbosa. And we were not able to answer all your questions, but you can send us to PAHO's email, and we will be glad to answer your questions. And now you have on the screen at the dashboard, PAHO's dashboard, where you can find information on the response, the impact and the response on this pandemic of COVID-19. Thank you, everyone, for participating in the session, and may you have a good day.